So, what exactly should a diet be in somebody that has chronic pancreatitis? You talked a little bit about how it needs to be individualized, but are there certain things that everybody with chronic pancreatitis should have as part of their diet, or certain things that they should avoid?
Absolutely. Thank you for this question, Dr. Forsmark, because this is a very important and essential issue for patients with chronic pancreatitis. Yes, of course, every diet must be individualized according to a person's likes, dislikes, and ability to tolerate certain foods. As was previously mentioned, a low fat diet tends to be the foundation of the recommendations from pancreas providers. A low fat diet is the foundation of dietary recommendations in chronic pancreatitis. This, at least theoretically, helps to avoid fatty foods, which are thought to trigger episodes of pain and sometimes episodes of acute on chronic pancreatitis in this patient population. It's important for patients to maintain with the low fat diet as the baseline, an otherwise varied and healthy diet, though, with 4 to 5 servings of fruits and vegetables per day, and a varied diet with whole grains and all the rest of the nutrients that encompass a balanced diet. It's important for patients to stay well hydrated, and important for patients, as always, to avoid alcohol and tobacco, which is another foundation of recommendation in chronic pancreatitis. As the patient explores different options for maintaining their balanced diet, it's important also for the patient to take in other vitamins and supplements at the direction of their provider, especially to target any deficiencies that have previously been detected. Sometimes patients can use nutritional supplements to help with this. And more frequently, patients are prescribed pancreatic enzyme replacement as a way for them to break down the food that they're eating and make sure that they're absorbing everything they're taking in adequately.
Thank you. And I'll remind everybody that Dr. Galroot had mentioned earlier, but there is, I think, a very useful cookbook that's on the National Pancreas Foundation website that focuses on many of these sort of low-fat approaches to minimize symptoms. Dr. Phillips, one of the things that you didn't mention, I wonder if you could comment on, is a common recommendation that patients take multiple smaller meals rather than 3 really large meals. What are your thoughts on that?
I think that's a great question. Thank you, Dr. Forsmark, for raising this. Because the patients with chronic pancreatitis that have difficulty taking in large meals can benefit from taking in smaller meals. This can allow them to more gradually over the course of a day take in an adequate number of calories, as well as ensure their ability to take in all of the necessary vitamins and minerals. And so this can be a very effective strategy, actually, to maintain their weight and maintain their intake, even when they're not able to eat more normal sized meals.